Hi, this is your epilepsy neurologist, Dr. Omar Danoun. I would like to talk today about Levetiracetam or Keppra. We'll talk today about its mechanism of action, its indications, doses, side effects, and precautions of its use. The way levetiracetam works, or the mechanism of action, is it inhibits the SV2A proteins. Those proteins are available in the synapse, and they control the release of neurotransmitters and decrease the flow of electricity in the brain and control seizures. Also, it can partially inhibit the N-type calcium currents, and those also can decrease seizures. Indications of levetiracetam are to treat epileptic seizures, and it's considered a broad-spectrum anti-epileptic drug that has wide range of uses. It can treat partial or focal seizures. It can treat generalized or primary generalized tonic-clonic seizures, and also treat myoclonic seizures in primary generalized epilepsy. Doses of levetiracetam varies, and luckily it comes in with multiple forms. It comes in tablets, extended release tablets, liquid form, and even injectables. Usually we will start with 500 milligram twice a day, and then increase it accordingly depending on the seizure control that is desired. Usually the maximum dose is between 3,000 and 4,000 milligram a day. It can be either given split it 2 times a day, or using the extended release can be all given once a day. Levetiracetam is generally a safe medication. However, it does have multiple side effects. The common side effects including somnolence, fatigue, and dizziness. Psychiatric side effects are the most worrisome here, including depression, anxiety, and irritability. Rarely, it can cause thrombocytopenia, anemia, and even leukopenia. One of the warnings are suicidal ideations, Stevens-Johnson syndrome, toxic epidermal necrolysis, angioedema, and even anaphylaxis. Precautions when we use levetiracetam include we should avoid using in any patient with psychiatric history like depression or anxiety. In patients who have hemodialysis, we should be aware that hemodialysis filters out 50% of the medication. So it's advised to replace 50% of the dose right after the dialysis session is done. And that's it for levetiracetam. Thank you so much for listening, and see you in the next video.